Children's mental health. The topic for today is children's mental health. Let's discuss about children's mental health. It is as important to care for your children's mental health as it is to care about their physical health. Back in past centuries, any discussion related to a person's mental health was automatically assumed to mean that the individual had a problem with his sanity. Today we know that such assumptions are incorrect. What was termed insanity may well have been a state of depression, anxiety, or bipolar disorder. These are all problems that can be corrected. There are several types of behavioral disorders, and they are also often referred to as disruptive behavioral disorders. They are quite common in children of all ages, and are usually the reason that some children are referred to specialized healthcare practitioners for evaluations and/or treatment. Contrary to what many parents might believe, all children's mental health problems are not the same. Among the different types of behavioral disorders are those that you probably hear of quite often: attention deficit, hyperactivity disorder, ADHD, conduct disorder, and oppositional defiant disorder. ADHD is one of, if not the most, researched subject within the field of children's mental health. It can be seen in children at a very young age, and the symptoms most oftentimes occur altogether. Many parents recognize that their children are inattentive, impulsive, and are highly active. For most, the signs of ADHD are not blatantly clear until the child reaches elementary age and begins attending school. Regardless of what age a parent realizes that their child may be suffering from this disorder, they surely want to know what caused it to happen and what can be done about it. What is known is that ADHD is a biological disorder of the brain. Although it has yet to be confirmed, studies suggest that the disorder is genetic. Additionally, it has been found that children having ADHD have a lower brain metabolism in the areas that control attention, social judgment, and movement. Conduct disorder is characterized by antisocial behavior. Children suffering from this disorder invariably exhibit actions that violate others' rights. They often act outside of age-appropriate social standards and rules. Some of the behaviors seen in these children or adolescents often include irresponsibility, delinquency, and physical aggression toward others. Those affected by conduct disorder resort to truancy or run away frequently, and they even commit crimes of theft, assault, or in extreme cases, rape. With the effects of conduct disorders being so extreme, it's natural to wonder if you, the parent, is at fault and what you can do to help your child. Many medical experts have concluded that conduct disorders are multifactorial, and often are caused by a combination of biological, physiological, and external factors. Over time and with help, this problem can be corrected. Oppositional defiant disorder is another of the common types of behavioral disorders, and it's characterized by uncooperative and annoying behaviors towards others, especially authority figures. Children and adolescents with OD cause a lot of stress and trouble for the people around them. Though there is no definitive cause of OD, there are a few theoretical explanations for the development of the disorder. One such developmental theory suggests that the problem starts when children are toddlers. They have difficulty learning apart from the primary attachment figure, and thus, their autonomous skills don't properly or fully develop. Learning theory suggests that the characteristics of OD are simply learned attitudes that reflect the effects of negative reinforcements that are commonly used by parents and authority figures. Although the exact causes of these different types of children's mental health disorders is not always known, it has been identified by various research that disruptive behavior disorders are caused by both biological and environmental factors. In any such case where a child is suffering from or thought to be developing a behavioral disorder, it is always important and necessary to seek the assistance of a qualified medical professional for advice in dealing with the situation.